Montgomery, Alabama. Good to have you with us. So here's the group who were still dancing last night and you were this morning. We're really glad to have you here. We want to hear your story. So are you ready to share that story with us?
Yes, ma'am, we are!
Let's see you.
We are Montgomery, Alabama, known as the capital of dreams because we have a reputation of being a place where dreams become reality.
Montgomery, the city where Jefferson Davis took the oath of office to become the President of the Confederacy, and the city where the order was given to attack Fort Sumter and start the Civil War.
Just 40 yards from that location, Rosa Parks boarded a Montgomery City bus, refused to give her seat for a white man, and gave birth to the Civil Rights Movement.
Montgomery, the city where the white boys opened the world's first civilian flight school, and where the first flight of an airplane had not occurred.
History's dreams came true in Montgomery.
Today, Montgomery is home to the Maxwell Air Force Base and the Gunner Range. Every Air Force officer comes to Maxwell doing his or her career, and Gunter is the IT nerd center for Air Force operations worldwide. Montgomery is where Honey Motor selected to build its first North American assembly plant, one of the most automated car manufacturing facilities on the planet.
Montgomery, home of Little High School, the #1 ranked high schools in the country. Root-taking BTW High School, all ranked among the top high school schools in the nation.
President's dreams are coming true in Montgomery.
Montgomery's future, a unique program to attract physicians and to encourage high school students to become healthcare professionals. And we have a campus of the UAB School of Medicine in Montgomery.
Montgomery, holding on to our young professionals outreach programs like the Mayoral Young Professional Council and creating opportunities so young professionals who used to live elsewhere but were from Montgomery, like myself, will come back home.
Montgomery, growing our tourism industry through our CBB and Sports Commission to host high school collegiate championships and the brand new ESPN Chameleon Bowl in December.
Dreams of the future will come true in Montgomery. We feel good.
Yes, Montgomery is the capital of dreams, but first we had several wake-up calls. In 2010, a national poll showed that Montgomery, Alabama was tied for having the highest obesity rate in the country. The mayor appointed me to be in charge of getting the entire community to lose weight. Unfortunately, there are no magic levers that governments can use to get people to start eating salads instead of eating donuts or go on 20-minute walks instead of eating couch potatoes. I needed help from a group called CARDAC.
CARDAC has expertise in engaging communities to action and pursuing grants. We formed the River Region Obesity Task Force, which is composed of 85 public and private partners. One of our first accomplishments was winning a grant for Safe Routes to School Day.
42 schools, including mine, and 28,000 students across the region have developed Safe Routes to School programs. For the kickoff, parents and school buses were instructed to drop kids off 1/2 mile away from campus. Teachers serving as chaperones ensured everyone made it to school safely.
To get students like my friends and me excited about walking to school, there are contests held where the winners got new bicycles and helmets to let us know how important it is to get exercise.
We use the Safe Routes to School health model to ensure that communities were focusing on obesity, and using that information, we made sure that communities were made aware and of the principles so that they could follow them. Thank you.
We feel good.
The very same survey that showed that Montgomery was tied for having the highest obesity rate in the country also showed that fewer than half Montgomeryans regularly eat fresh food and produce. Southern cuisine, y'all know what I mean, fried chicken, fried fish, fried everything, was killing us. We reached out to a group called Eat South to get help with bringing urban farms to Montgomery.
Eat South's urban farms address two key issues. We help people who live in food deserts where it's almost impossible to get fresh food. And we also teach everyday Alabamians how to get fresh food and why sustainably, locally grown produce is so important.
As kids, we see commercials for sodas, Big Macs, Sugar Breakfast Cereal King. No,
to our farms, where students participate in hands-on activities such as planting seeds, harvesting food, and tasting fresh fruits and vegetables on the farm. We believe that every child in Alabama deserves a good food day.
Eat South also has a program that builds gardens in schools like mine. Teachers receive training on how to teach kids about gardening and the value of good nutrition. Schools partner with Eat South for a 3-year period.
Eat South also partners with restaurants and chefs like me to be able to provide fresh produce that can go from farm to table all in the same day. We also sell shares so residents can take home that same food.
There's a summer internship planned for teenagers. Over an 8-week period to learn about farming, nutrition, cooking, and business skills. In the beginning, most of them don't know much about farming and produce, but by the end they do spread the info to their families too.
Eat South has an army of volunteers. I use my skills as an accountant to help with the financial committee, and I help plan fun events. Last year, more than 4,000 people attended our events, where they learned about the value of food that tastes good and is good for you.
In 2007, we got a wake-up call about the huge cost of indigent care. Montgomery's hospitals were spending an unsustainable $30 million to provide health care to uninsured and underinsured patients. We reached out to a group called Envision 2020 for help.
We are a group of citizens, business leaders, and elected officials who come together to tackle community problems. For this problem, we engage a nationally known health care expert to analyze the indigent healthcare needs of our population.
The Mr. Hill Clinic was Montgomery's federally qualified health center. However, there were problems with this building. There was not adequate parking, it wasn't in a safe location at night, the ventilation wasn't good for employees or patients like me.
The clinic is operated by Health Services Incorporated, where I am the COO. We recognized Mr. Hill's problems and knew the best thing we could do for our patient is to replace that 40-year-old clinic. But building a new clinic would cost millions of dollars.
Our consultant made the very same recommendation and had the very same concerns about money. At the same time, the federal government made the stimulus dollars available. For our city's application to rise to the top, we had to show widespread community support.
That's right. The City of Montgomery and Montgomery County partnered together to pledge $2.5 million towards the new health clinic. Jackson Hospital, where I'm an administrator, purchased land near our hospital for $1 million. They pledged this land towards the new clinic.
In December of 2009, we received a grant of $11.3 million, one of the largest in the country. In addition, with the donations from the county, the city, and Jackson Hospitals, we had $15 million to build a new clinic. 13 months later, we opened the door to the new River Region Health Center. We went from this 40-year-old facility to this state-of-the-art 50,000 square foot facility.
Just as Montgomery, Alabama was the capital of dreams for the Wright brothers when it came to civilian flights and to Rosa Parks when it came to civil rights, we are still the capital of dreams. Montgomeryans see problems, we pull together, we roll up our sleeves, and then we make dreams come true. River Region Health Center, tell us what you've done for indigent health care.
In 2007, the Mr. Hill Clinic saw 29,000 patients. In 2013, that number increased to over 37,000. That means we can now provide more quality medical services.
But we are still not finished. In February, we opened 2 new health centers with exercise equipment and health classes. Instead of treating sickness, the idea is to promote good health, because that's how we do it in Montgomery.
Eat South is broadening its mission. The new River Region Food Policy Council is working with community leaders, gathering information, and coalition building so that we can create a better food policy system for the city of Montgomery. At the same time, we spent over 11,500 hours of educational programming for Alabama's children.
Last year, Eat South sold over $50,000 worth of fresh fruit and produce, and we still can't meet the needs of our local citizens. We also have polls that show that 12,000 new people are eating produce regularly. So in Montgomery, we like to play in the dirt and teach people how to eat healthily.
For the Capital Dreams, we're providing the dream of good health to all of our community people so that every morning, one day, people in Montgomery will all be able to wake up and say, "We feel good!"
Thank you very much. I looked at your hands to ask you questions, so I'll pay attention to that too. I want you to know we feel good because we've been here. Thank you.
Mission to accomplish.
It paid not to go to sleep last night. Well, we have a group of families that have lots of good questions because you've done lots of good things. I believe, Terry?
Okay. I'm quite jaded with the notion of the capital dreams. That says a lot, and it says a lot about you. But what I'm hearing is a series of responding to wake-up calls, right? You got a wake-up call about obesity, a wake-up call about medical issues. Where did all this, how did this come together? Where did leadership come from to take all these different things on and stay focused?
Visionary leadership is the name of the game. We're not a super large city like Chicago or New York. We know that we're small, we're going to all be in the same foxhole, but we've got hard workers, smart people who are talented and dedicated to making Montgomery, the city that we all call home, even though many of us come from different places, be the best that we can possibly be. So indigent healthcare really was serious. We were blessed to have a mayor, a city council, county leadership in our legislative, state delegation, and Congress to say, what can we do to get better? And mercifully, we're doing that because the failure to expand Medicaid is causing rural hospitals in Alabama to close. Those patients who come to Montgomery, we're in a position to take care of them.
That's fantastic, Greg.
Yes, thank you guys for doing it. You certainly are doing a lot with regards to healthcare, obesity, and the Eat South initiative. You know, I heard from you that you had one of the highest obesity rates in the nation. You know, how are you tracking the trending of your obesity rate, and what statistics are you using besides the increase in people who attend facilities and the increase in people who eat healthy foods? What are your measurements?
The sole measurement that we use is the same survey that we got back in 2010. Gallup and Healthways does a national poll, polling 350,000 people. They asked them 17 minutes worth of questions, among them, how tall are you, what's your waistline, how often do you eat produce, and they release those results every year. Those are the results we go by. We went from 34.6 down to 27.1. Those 7.5 percentage point drops equal 15,000 fewer Montgomeryans in Montgomery who are obese, at risk of heart attack or high blood pressure, hypertension, diabetes.
Okay, thank you. Hugh, I believe you have a question.
I recognize that Montgomery is the city, but I would like to look outside the boundaries and see if we impact on any of the communities, any people, any populations outside the city, in the region.
Thank you for asking that question, because we certainly do. I'm the Executive Director of Envision 2020, which is a regional, 5-county regional planning process. And it includes Montgomery, Ottawa, Alabama, Macon, and Lowndes counties. Macon and Lowndes counties, and particularly Lowndes County, is one of the poorest counties in the whole country. A lot of their health care is received, but Health Services Incorporated actually has a clinic in Lowndes County to address that. I'm governed by a board of representatives from all 5 of those counties. So we do have a very collegial and collaborative relationship, understanding that we have many barriers to overcome, but we overcome them together. We have 25 goals, healthcare is one of them.
And I just wanted to add back this means that I did show you the River Region Health Center, which is our newest center. We do represent 6 counties, so we have other centers in 6 counties. They're not as grand, but they're just as beautiful. and people would receive the same quality health care that they deserve in Montgomery.
Thank you. Christine, have you have a question?
Montgomery, making us feel good, you look really good too. So thank you so
Small
much
shouts.
for that. A follow-up question on your Eat South program, which is really incredible. And you talked about you're also looking at how you influence the food policy system. So I know you're educating and I know you're in schools. Have you actually seen a change in the meals that schools are serving from and how that work is going? So it's more than just a sort of class or one-time.
Yes, ma'am. I'm Denise Reed, Executive Director of Eat South, and Natalie is on our board for the River Region Food Policy Council, which is really just gearing up, ready to go. It's an organization up under Eat South. We are, and I would say Alabama, Montgomery especially, is right on the cusp of making major changes in our city and county schools. And historically, we probably have some of the worst. But we're really making major changes, and I feel great about it.
One of the things that we do with the Food Policy Council is we've gone around the state, not just the Montgomery region, and hosted food policy listening sessions. So we ask people, where do you buy produce? Do you eat local food? Does that matter to you? Does it matter if it's organic or not? And the way that we hold these listening sessions is by going to all different types of groups. So we're going to churches, we're going to schools, we're engaging teachers as well, so that it's a whole community effort. And so we know that schools aren't isolated. It takes parents, it takes the whole community to want to change the food that's in schools. And so that's what we focus on, is really bringing up the whole level of education around what a food system is and why it's important to make efforts and changes.
Thank you, Danny. Good morning.
Good morning.
Everything you said has just been fantastic. I'm going to switch gears a little bit. I believe this main podium in the back talked about the young leaders, and they are meeting with young people across the country. We're looking at leadership and we're focusing on youth. And I know in many communities across the country, 25 to 44-year-olds really trying to get their voice heard. So I'd like to learn a little bit more about your Emerge program. I believe it's Torchbearers, or talk about a little bit in there.
Right, and that's a program where kind of the adults in the community will get together and they know that we are the future. So they help provide kind of a path to lead us to success with the Torchbearers program, which is part of Emerge. And I think you've actually been in it.
I actually completed the Torchbearers program, and I moved to Montgomery, Alabama from Gainesville, Florida, where they recruited me from the University of Florida about 5 years ago. And I had no friends and didn't know anyone. And the Torchbearers program was the gateway for me to meet 40 other young professionals and establish relationships and a network immediately with 40 other young professionals. And it was amazing. It's a 9-month program that meets once a month for a day-long program. And by the end of the program, you're able to have implemented a project within your community that actually has an impact on the community, and you're able to interface with all of the leadership in your community. So it's a really interesting program, and it's enabled me to get to know the mayor on a first-name basis. I sit on our mayoral young professional council and just really have a seat at the table. So
All of our 501c3s and nonprofits have established boards of directors that are beginning, frankly, to age out. So the newest thing that we've seen in Montgomery is the establishment of junior boards. We've got several members who are on junior boards that help the museum get ready for the next generation of philanthropy that's going to be needed.
I now sit on a lot of boards within our community, and they've recruited young professionals from Torchbearers. And he's telling me now that I don't need to share any other more information with you, but I'm glad to at a later date.
Angela, we have some questions.
Good morning.
Good morning.
Good morning. So this is just taking it even younger, actually. I'm really inspired to see the young people who are there holding up the sign about results. And just wondering if any of you are interested in telling us what you're doing to get over and stay home.
When we're doing stay healthy, sometimes when we're at school, we go to walk to school, and my family and me, we go, people at the school, we all have fun walking, get exercise while doing it. And I think it's very fun, and it's excellent, and awesome to do that kind of thing. And I hope I'll be doing it next year in school.
In my school, we have a garden where we plant different vegetables with the program itself. We plant different vegetables and fruit like tomatoes, carrots, cauliflower, and varieties of that nature. And it's very fun. And once they grow fully out, we get to take them home and eat them with our families.
All right, thank you.
At my school, our gardens are very healthy, and we get to pick the tomatoes and potatoes and carrots and all that good healthy stuff. That will make our body very healthy. At my school for the walking, I have seen a big change in it because mostly you don't really see a lot of kids walking to school back from school. But if you tell kids to, they will eventually, and you can see a huge difference in it, and that's what my school program is.
At my school, we use our gardens, and in the cafeteria, the food menu has had a big difference. We went from having pizza on Fridays and we had salads. I mean, it would be every now and then we would have taco salad.
What an impressive community. Thank you for starting our day. It was a great story. You had a great thing to share. I think the thing that impresses me about Montgomery is looking at you as these are just not governmental agencies and committees that are doing this, but you community people are rebuilding your community. And when you learn that, you learn the secret. I will tell you that. So I thank you for sharing that with us. And for you children, thank you for being here. It's always amazing. There was one little girl that was holding the sign over there, and all I could see was her eyes, which was pretty impressive. But I thank you for sharing all the good things you're doing in your community, and the fact that you're a team committed to doing it together and having everybody share was really impressive. So thank you for being with us today at Montgomery, Alabama. Thank you.
This community collaborates to develop new ideas. This community relies on partnerships to tackle obesity. This community believes in healthy food access for all. I'd like to announce the All-America City of Montgomery.
First thing we really want to do is say thanks to the National Civic League for just putting on an institution like this that serves to be an inspiration and a battery recharger. And then we want to say thank you to all of the other finalist communities because we listened to your presentations, we loved your ideas. Those ideas will be stolen or borrowed or Montgomery. And I really want to thank these folks right here. This is going to be an award that inspires them because they work so selflessly and so tirelessly to help people in Montgomery sometimes who aren't able to help themselves, and often they don't even know that they are the beneficiaries of the brain power and the hard work that goes on to doing this. And just as this will inspire them to keep on keeping on when we get back to Montgomery, capital dreams. It's going to inspire those of our citizens who haven't decided yet that they can reach out and do more and sacrifice themselves to make Montgomery the best place that it can possibly be. So we're grateful that this is going to happen. You know, we got the Best Historic City by USA Today last month. Magnet school in the country. We get awards and recognition for our CVB efforts and tourism and job recruitment, but none of that stuff matters at all if you aren't healthy. This is just a great pat on the back, and it's going to inspire us to keep on doing the things that we need to do. And we've also been listening to your places, and you've altered our bucket lists of where we want to go for our travel destinations. I definitely want to go. Well, I don't think we start saying it. And then we want you guys to come see us, okay? In March, we're going to celebrate the 50th anniversary of the Selma to Montgomery Walk or March for Civil Rights, and that same year, the 60th anniversary of the Montgomery bus boycott that gave birth to the Civil Rights Movement. And that's just thank you guys for don't come on and see us, all right? And we learned to say this in one of the resolutions this morning. We love you.